I've been seeing a bunch of Google searches lately for methadone versus buprenorphine or methadone versus Suboxone, so I decided to write a post about it. I asked three awesome doctors, two of whom are on TikTok, so I'll tag them below in the comments, to explain the differences between these two important medications. We talked about how each of the drugs works, what it feels like to get started on them, and how the access and regulations around each one differs. The first difference, of course, is in how they work. Methadone is a full opioid agonist, whereas buprenorphine is a partial opioid agonist. That means that as you increase the dose of methadone, it's going to have more and more of an effect on your brain and body. But that is not necessarily true for buprenorphine. As you increase the dose, you will have more of an effect, but you will reach a ceiling dose, at which point increasing the dose will not give you any more benefit. That can be really important if you have a very high tolerance for opioids. Interestingly, as the illicit supply has grown more and more potent, doctors are prescribing doses of both methadone and buprenorphine that are higher than they used to in the past, and they're saying that both of these are working. So for some people, that might be that the ceiling dose for buprenorphine is higher than we originally thought. The second difference is in how you start and how you get to a stable dose. For methadone, you don't have to be in withdrawal or anything to start, but you do have to start at a dose that is well below the one that's actually going to be therapeutic and help stave off withdrawal symptoms and cravings. And traditionally, it can take weeks to months to increase that dose up to a place that's really going to be helpful for you. Historically, for buprenorphine, you actually had to be in active withdrawal before you could start taking the drug. If you're not, then the medication will put you into withdrawal. So that's a pretty big hurdle for most people getting started on either one of these medications. For that reason, researchers have been studying ways to get people started faster and safer. Lately, they have found ways to start buprenorphine before you're actually in active withdrawal to make that transition a lot more comfortable. And for methadone, they found ways to ramp up your dose much faster than they used to before. Lastly, we talked about what it looks like to access each one. Of course, methadone is only available in the US at opioid treatment centers, which are federally regulated. You can't get them at your regular pharmacy, you can't be prescribed by your normal doctor. For buprenorphine, you can get a prescription from your normal doctor and you can pick it up at your normal pharmacy if they stock it, because not all pharmacies stock it. And some people do report that they experience stigma and frustration from the pharmacist when they try to pick it up. To read more, check out the link in my bio.